Imagine a world where we could peer inside the human body without surgery, mapping our organs and tissues with remarkable detail. This is the power of magnetic resonance imaging, or MRI, a technology revolutionizing healthcare. At the heart of MRI lie gradient fields, invisible forces that shape and direct magnetic fields within the scanner. These fields, while invisible, are not inert. They interact with the human body, creating a symphony of effects that enable us to generate those stunning images we see in hospitals and research labs. But just like any powerful tool, understanding their limits and potential impact is crucial for ensuring patient safety. This is where organizations like the International Commission on Non-Ionizing Radiation Protection and the Medicines and Healthcare Products Regulatory Agency step in. They establish safety guidelines, acting as guardians at the gate, ensuring that the incredible power of these magnetic fields is harnessed safely and effectively. In the realm of medical imaging, safety is paramount. ICNIRP and MHRA play a vital role in establishing limits for gradient field exposure during MRI procedures. Think of these limits as carefully calculated boundaries, ensuring that the powerful forces used to generate images don't pose risks to patients. These organizations consider various factors, including the strength of the magnetic fields, the duration of exposure, and the specific part of the body being scanned. They also take into account the potential for induced currents, which can occur when rapidly changing magnetic fields interact with conductive tissues in the body. By setting these limits, ICNIRP and MHRA act as guardians, ensuring that the incredible power of MRI is harnessed safely. These guidelines are constantly reviewed and updated as our understanding of these fields and their impact on the human body evolves. MRI machines are not one-size-fits-all. They operate in different modes, each tailored to specific clinical needs and safety considerations. Think of these modes as gears in a car, allowing for different levels of power and performance. Normal operating mode, as the name suggests, is the standard setting used for most routine scans. It strikes a balance between image quality and patient safety, adhering strictly to established exposure limits. Controlled mode, on the other hand, allows for slightly higher levels of gradient field strength, but only under strict supervision and justification. This mode might be used for specialized scans requiring greater detail or for research purposes. Finally, research mode offers the greatest flexibility, allowing scientists to explore the full potential of MRI technology. It's crucial to remember that each mode comes with its own set of safety protocols and safeguards. The transition to higher modes requires careful consideration and adherence to strict guidelines, ensuring that patient well-being remains the top priority. Section 4. The body electric: how gradient fields interact with us. Our bodies are, in essence, intricate electrical systems. Nerves fire, muscles contract, and our hearts beat thanks to a delicate balance of electrical signals. This is where the interaction between gradient fields in the human body becomes particularly fascinating and potentially concerning. The rapidly changing magnetic fields generated by MRI machines can induce electric currents in conductive tissues, like our nerves and muscles. Think of it like holding a wire near a powerful magnet. The magnetic field can induce a current in the wire. Similarly, these induced currents can stimulate nerves, causing tingling sensations or even involuntary muscle contractions. In most cases, these effects are mild and temporary. However, in certain situations, they can lead to more noticeable sensations or discomfort. This is why understanding the principles of electromagnetic induction and carefully monitoring patients during MRI procedures is crucial for ensuring their safety and well-being. Section 5. Vulnerable devices: protecting patients with implants. The marvels of modern medicine extend beyond imaging to include life-changing devices like pacemakers and cochlear implants. These devices, while miraculous, introduce a new layer of complexity when it comes to MRI safety. Why? Because these implants often contain metal components that can interact with magnetic fields. The same forces that allow us to peer inside the human body can potentially interfere with the delicate electronics of these devices. This interference can range from minor disruptions in function to more serious consequences, depending on the type of implant and the strength of the magnetic field. Therefore, patients with implants require special attention and precautions during MRI procedures. Careful screening, meticulous planning, and in some cases, the use of specialized MRI-compatible devices or alternative imaging techniques are essential to ensure their safety and well-being. Section 6. The power of stillness, effects of strong static fields. While gradient fields are the pulsating heart of MRI, generating the rapidly changing fields needed for imaging, there's another force at play, the static magnetic field. This field, as its name suggests, is constant, providing a stable backdrop for the dynamic dance of gradient fields. The strength of static magnetic fields is measured in Tesla, and most clinical MRI systems operate within the 1.5 Tesla to 3 Tesla range. However, research is pushing the boundaries with ultra-high field MRI systems exceeding 7 Tesla, and some experimental systems reaching a staggering 23.5 Tesla. While these high-field systems offer exciting possibilities for scientific discovery, they also introduce potential safety concerns. Exposure to strong static magnetic fields can cause a range of effects, from mild dizziness or vertigo to more serious issues like heart rhythm disturbances.